Hey everyone, welcome to Health Informer. America's attention has been focused on the coronavirus for the past 2 years, but now monkeypox is on their radars. The Centers for Disease Control and Prevention, CDC, says that 1 case has been confirmed and 4 suspected cases have been identified of monkeypox in the US, a rare disease closely related to smallpox. As a result, people all over the world have begun to search with fear on the internet for their following doubts and questions. What is monkeypox? What are the signs and symptoms of monkeypox? How is monkeypox transmitted? Is monkeypox deadly? Is there any vaccine for monkeypox? How to prevent monkeypox? This video is the answer to all your doubts and questions related to monkeypox. So let's get started. What is monkeypox? Monkeypox is an extremely rare disease caused by infection with the monkeypox virus. Viruses that cause monkeypox belong to the orthopoxvirus genus in the Poxviridae family. Viruses that cause monkeypox are endemic in Central and West Africa. According to the Centers for Disease Control and Prevention, it is similar to but less severe than smallpox, which is caused by a related virus. Where is monkeypox found for the first time? The monkeypox disease was first discovered in 1958, when 2 outbreaks of a pox-like disease broke out in monkey colonies used for research. Hence it got the name monkeypox. The first human case of monkeypox was recorded in 1970 in the Democratic Republic of the Congo, when efforts were intensified to eradicate smallpox. Monkeypox has been documented in several more Central and Western African nations since then, including Cameroon, Central African Republic, Ivory Coast, Democratic Republic of the Congo, Gabon, Liberia, Nigeria, and Sierra Leone. A large number of infections are reported in the Democratic Republic of the Congo. Cases of monkeypox in humans have been reported outside of Africa and have been linked to international travel or imported animals, including cases in the United States, Israel, Singapore, the United Arab Emirates, and the United Kingdom. Are you enjoying this video? If yes, hit the like button. That is very much appreciated. What are the signs and symptoms of monkeypox? In humans, monkeypox symptoms are similar to but less severe than smallpox symptoms. The symptoms of monkeypox include fever, headaches, muscle pain, and fatigue. The main distinction between smallpox and monkeypox symptoms is that monkeypox causes lymph nodes to swell, whereas smallpox does not. The incubation period for monkeypox, or the time between infection and symptoms, is usually 7 to 14 days, but it can vary from 5 to 21 days. The illness begins with fever, headache, muscle aches, backache, swollen lymph nodes, chills, and exhaustion. Within 1 to 3 days, or sometimes longer, of the onset of fever, the patient develops a rash, which usually begins on the face and spreads to other parts of the body. The illness usually lasts between 2 and 4 weeks. Is monkeypox deadly? In Africa, monkeypox has been shown to kill up to 1 in every 10 people who develop the disease. How is monkeypox diagnosed? Other rash disorders that must be investigated in the clinical differential diagnosis include chickenpox, measles, bacterial skin infections, scabies, syphilis, and medication-associated allergies. Lymphadenopathy in the prodromal stage of sickness can be used to differentiate monkeypox from chickenpox or smallpox. If monkeypox is suspected, health workers should acquire a suitable sample and have it safely delivered to a laboratory with the necessary capabilities. The kind and quality of the specimen, as well as the type of laboratory test, are used to confirm monkeypox. As a result, specimens must be packaged and sent in line with national and international standards. Because of its precision and sensitivity, polymerase chain reaction is the primary laboratory test. How infectious is monkeypox? Typically, it does not result in large outbreaks. Most years, there are only a few cases outside of Africa, if any. In the United States, the most severe outbreak occurred in 2003, when dozens of cases were linked to contact with infected prairie dogs and other pets. According to the World Health Organization, this was the first outbreak of monkeypox outside of Africa. Since 1970, when the first human case was identified in a 9-year-old boy in the Democratic Republic of the Congo, 11 African countries have reported cases. Since 2017, Nigeria has experienced a large outbreak, with more than 500 suspected cases and 200 confirmed cases, according to the World Health Organization. How many cases have there been this year, and where have they been? According to the World Health Organization, cases had been identified in 12 countries outside of the African countries, where it is endemic by late May this year. The first case in the United States was discovered on May 18th in Massachusetts. The man had recently returned from Canada, where there have been fewer than 5 cases this year, but 11 to 20 more are suspected. According to public health officials in Florida, one presumptive case of monkeypox has been identified in Broward County, in a person who recently traveled internationally. In addition, public health officials in New York City stated that they had tested 2 patients suspected of having monkeypox. Europe has been hit much more severely. According to the World Health Organization, Portugal and Spain each reported between 20 and 30 cases. In the United Kingdom, the Health Security Agency reported finding 56 cases of monkeypox in England. In Belgium, France, Germany, Italy, the Netherlands, and Sweden, fewer than 5 cases were reported. Australia has also reported 2 cases in men who had visited the United Kingdom. The United Arab Emirates was the first Gulf country to report a case of monkeypox, claiming that it was fully prepared to deal with any outbreak. The case was discovered in a 29-year-old woman arriving from West Africa, who is currently receiving medical treatment, according to the Ministry of Health and Prevention. How is monkeypox transmitted? Whenever a person comes into contact with a virus, whether it is from an animal, a human, or contaminated materials, the virus is transmitted. Infections occur when the virus enters the body through open or broken skin, the respiratory tract, the mucous membranes, the eyes, nose, or mouth. Animal-to-human transmission can occur through a bite or scratch, preparation of bushmeat, direct contact with body fluids or lesion materials, or indirect contact with lesion materials, such as through contaminated bedding. Human-to-human transmission is believed to occur primarily through large respiratory droplets. A prolonged face-to-face contact is required because respiratory droplets can only travel a few feet. There are also indirect methods of transmission between humans, such as through contaminated clothing and linens, as well as direct contact with body fluids and lesion material. The reservoir host of monkeypox means its principal disease carrier remains unknown, although it is suspected African rodents are involved. What is the treatment for monkeypox? As of right now, there is no proven, safe treatment for monkeypox virus infection. There are several things that can be done in order to control an outbreak of monkeypox in the United States, among them smallpox vaccine, antivirals, and vaccinia immune globulin. Because the virus that causes monkeypox is closely related to the virus that causes smallpox, the smallpox vaccine can protect against monkeypox. Previous African data suggests that the smallpox vaccine is at least 85% effective in preventing monkeypox. Is there any vaccine for monkeypox? In the United States, the Food and Drug Administration has approved Jynneos, also known as Imvamune or Imvanex, to prevent monkeypox. To protect high-risk people, the United States has begun releasing monkeypox vaccines from its strategic national stockpile. Smallpox and monkeypox are both prevented by the 2-dose vaccine. How to prevent monkeypox? Prevention of infection with the monkeypox virus can be achieved in a number of ways. Number 1. Avoid animal contact if they are known to harbor the virus, including wild animals, animals that have been found sick or dead in monkeypox areas. Number 2. Avoid touching any bedding or materials that have come into contact with sick animals. Number 3. Isolate infected individuals from others who are at risk for infection. Number 4. Whenever you come into contact with an animal or a human that has an infection, keep your hands clean. Washing your hands with soap and water or using a hand sanitizer containing alcohol are effective ways to prevent the spread of illnesses. Number 5. Protect yourself when you are caring for patients with personal protective equipment. I hope you found this video useful and informative. Please share this valuable information to your family and friends. Please give us a thumbs up and be sure to subscribe, because more incredible content is on the way. Thanks for watching.